A very good afternoon and welcome to the session on the topic thyroid and its effect on fertility. We are glad to have Dr. Aruna Sahadev among us today to help us understand the topic. The doctor will take us through more in the session today. And if you have any doubts, any queries related to the topic or related to fertility, you can ask the doctor in the comment section. The doctor will take all your questions by the last of the sessions. So stay tuned till the last. And doctor, you have the stage.
Good afternoon, everyone. This is Dr. Aruna who will be talking now about thyroid and fertility and its effects on fertility. As we all know, thyroid gland is an important endocrine organ which is present in the front of the neck, which controls our metabolism and reproduction. So what are the thyroid hormones? Normally it secretes T3 and T4, and it is controlled by TSH, which is the hormone which is secreted from the hypothalamus. So, what are the effects of thyroid hormones? Thyroid hormones usually have an effect basically on our metabolic basal metabolic rate. So, whenever there is increased basal metabolic rate, we have to look for hyperthyroidism. When there is decreased BMR, we have to look for hypothyroidism. So, what are the effects of hypothyroid on the females? So, basically, it increases prolactin levels, which in turn results in galactoria and anovulatory cycles, and there is delay in the puberty as well as recurrent miscarriages, which when we detect the hypothyroid in the early part of pregnancies, or the patients conceives with being a hypothyroid states, so there are chances of having abortions or early recurrent miscarriages, and there is increased incidence of infertility along with, because as a result of increased prolactin levels, which would result in anovulatory cycles and which in turn results in polycystic ovarian disease. So in the males, it mainly results in low sperm count and increases androgen levels, decreases androgen. Yeah. So there serum TSH level is recommended for all the women who are seeking for infertility issues. So the normal TSH levels anywhere should be less than 4.5 for a normal in a female life. But those who are uh, getting to try to for conceiving, the should be less than 2.5. So, what are the two types of thyroid disorders we come across? One is hypothyroidism, another one is hyperthyroidism. So, hypothyroidism can be an overt hypothyroidism or it could be a subclinical hypothyroidism. What do you mean by overt hypothyroidism is whenever there is an elevated serum TSH levels and low FT4, and these patients are symptomatic of hypothyroidism. So, what are the symptoms? Common general symptoms other than infertility things are like the patient can have hair loss, constipation, or decreased BMI, and they're lethargic and putting on weight. Could be these are the general symptoms of hypothyroidism or constipation along with it. So these patients improve with putting on thyroid drugs. So whereas subclinical hypothyroidism are the patients who have elevated serum TSH levels but they have normal FT4 levels, and here the biochemical hormones levels are, but it's only biochemical hormonal deficiency, but clinically they are normal. So they would not have much symptoms as overt hypothyroidism. Then there is one more category called autoimmune hypothyroidism, which accounts for 5 to 20% of the chances. That is basically a immunological variety where there are auto antibodies which are produced against our own thyroid hormones. Okay. So, what are the impact of thyroid hormones? So, normally one third of subfertile, usually one third of them would be subfertile, and 50 to 70% of hypothyroid patients would have menstrual irregularities, and 46% of infertile patients would have hypothyroidism along with hyperprolactinemia, and 10% will have inadequate corpus luteal, and they'll end up with luteal phase defects and results in early abortion. So, what are the investigations we do with the patients with hypothyroidism are? serum TSH levels, FT3/4 and FT4 levels. So serum T4 TSH levels have to be brought down to less than 2.5 before starting in any infertility treatment. So the management would be putting on them on L-thioxin. So they may be considered for all subclinical hypothyroid patients and those who are attempting to have a natural conception. So low dose of LT4 therapy can be like 25 to 50 microgram should be given to all patients, which carries a very minimal risk and would help the patients with subclinical hypothyroid to conceive naturally, as well as would help us for the regular infertility treatment. So those who are undergoing IVF and ICSI, who should have a significant, see, the subclinical hypothyroidism would result in a lower fertilization, lower implantation, and significantly higher pregnancy losses. So these patients, compared to euthyroid patients, so these patients have to be given at least 25 microgram of L-thioxin before starting the treatment for infertility. And autoimmune thyroid disorders found to be increased with PCOS patients, so they would result in even endometriosis. Along with endometriosis, we can see the subclinical autoimmune thyroid syndromes also. So what are the treatment options? So IV immunoglobulin should be avoided, and treatment with L-thioxin is the gold standard. So depending upon the levels of TSH levels, we would either taper or reduce the dose, and the TSH levels have to be repeated every 4 weeks depending upon their initial TSH values, and steroids should be avoided, and ICSI should be the treatment of choice for those patients who are already an overt hypothyroid. And the other form, which is in hyperthyroid, is hardly we see those patients. I mean, it's very rarely encountered, which accounts for only 5.8%. So those patients, they usually are with increased BMI, and they have intolerance, heat intolerance, and they are more of stress related things. So they don't really encounter with infertility issues as such. So what are the recommendations, like foods to be avoided? Those who have already detected hypothyroid are the commonest drugs, which mean the commonly we avoid drugs, which are the food which should be avoided. Those with hypothyroid, maybe like the soya products has to be avoided, and the drugs which are, I mean, the medicine, the food which is rich in iodine, which are reduced in iodine, like cabbage, cauliflower, peach, strawberries, and peanuts should be avoided. And the food which are rich in iodine and selenium should be advised for the patients, like something like brown rice or sunflower seeds. And the dairy products are very rich in iodine and selenium, so should be taken along with L-thioxin medicines. So the ideal time, I mean, ideal thing should be like eating at least 4 times a day, and see that you don't skip your meal in between. And the medicine has to be taken in empty stomach completely in the early morning, and you don't skip your medicines, and see that, and you do the TSH levels every 4 weeks and maintain the dosage. And there are few yoga techniques which can be also used to control your thyroid levels along with your L-thioxin. It's not like you stop your L-thioxin and do only yoga. It has to be together. Maybe yoga would help you to reduce the dosage in future. And the lack of sleep is also one of the indication to get hypothyroid in life. So you need to see that at least sleep at least for 7 to 8 hours in a day, and to maintain your T3T4 levels. And meditation is one of the other form which can also be tried. So these are the few things which would help us to know the subject called thyroid disorders, and which would, that's how it affects the infertility. I think I would have covered the most of the aspects of thyroid along with the infertility aspects. So thank you for patient hearing. Thank you.